I'm Jim Harris. I'm from Chickamauga, Georgia, and I've been experiencing some pain for a number of years, and in my right shoulder. I had asked around, and a friend of my wife's had recommended Dr. Smalley. So I went there to check with him, and they did x-rays and found that, yes, I did have shoulder damage. And he came back and he said, I have good news, I have some bad news. The good news was no rotator cuff problems. But the bad news was the shoulder was just totally worn out, and it was just bone against bone. Well, for several years I've been just living with the pain. I'm an avid woodworker, and it requires a good bit of hand work. I found that as I would try to hammer things or use a drill driver, I was having to use two hands, doing hand sanding. It was just very painful to do that. And I got to the point that even as I would drink coffee, because I like a heavy mug for my coffee, and I couldn't even pick that up very easily. I'd have to assist it, or I got to where I was using my left hand to drink my coffee. Dr. Smalley looked at that and said, okay, you do have a problem, and there's 3 different ways that this can be addressed. One, you can start with anti-inflammatory pills. You can have a shot. You can do a combination of those, or surgery. And I said, well, I'm not really in favor of surgery, so let's start with the pills. And quite frankly, that was about as effective as a placebo would be. So I went back and saw his physician assistant, Katie Steen, and got a shot, and hoping that might give some comfort. And again, that had about as much effect as my granddaughter's pretend shot when I go to her Dr. McStuffin office. So I went back and said, okay, I guess the only thing we're going to do to make this better is surgery. He had told me, he said, you will be in the hospital for 1 night. I expect to spend 6 weeks in the sling. Probably have to sleep in the recliner for a little while, and have physical therapy. And then at about 6 months, I should be able to do most of my activities that I want to do with some restraint. And that has proven out well. I was just super satisfied with the surgery. I experienced very minimal pain. I did learn that the recliner was a smart way. I tried to sleep in bed the first night, and I need to get up in the middle of the night. It was a difficult process. I couldn't hardly get out of the bed. So for the next 2 weeks or so, I guess it was in the recliner. The sling, after about 2 weeks at home, I would take the sling off, and was fine. I was just careful. But if I go out in public, of course, I would wear the sling kind of as a defense mechanism, so people wouldn't grab my hand and shake my hand or bump my shoulder or anything. But the recovery has been extremely well. I've just had very minimal pain. I've been able to do most everything. It's been about 15 weeks. This was back in January of this year, 2014, that I had surgery. And the other day I was out cutting some firewood in the backyard, and just no problems. There's only a few spots I can't reach yet, but I can tell I haven't regained all my strength, but for the most part, I'm pretty much recovered. I just have to be a little smart and don't overdo things.